The National Crisis Preparedness and Response Center, or CPRC, is a center which is continually monitoring the disease surveillance and monitoring of the status of Ebola in the West African countries and other parts of the world, and how we should respond to the spread of this disease. Ebola is a notifiable disease in Malaysia. So far we have got 9 people who came with fever from Western Africa, mainly from Nigeria, whom we have tested, and they all tested negative. And at the present time, we actually have started screening at points of entry. Points of entry means all international airports, that is KLIA 1 and 2, and the other international airports like Penang, Kota Kinabalu, Johor Bahru, where every person who comes is actually screened for body temperature. And if there is high body temperature, they are taken away and they are being questioned. Otherwise, the next point is all those who come from these countries at the immigration counter. The immigration counter will look whether they have in the last 3 weeks visited any of the affected countries. And if they have visited any of these affected countries, then they will be asked to go to a quarantine area within the airport complex itself. Then they will be questioned as to possible contact with a patient with Ebola. If there is no contact with the patient with Ebola, they will be advised, counseled, and allowed to go. If they had contact with a patient of Ebola, we have decided and we discussed, even if they're asymptomatic, we will put them under supervised quarantine for 21 days, of supervised quarantine. And after that, if they are okay, we will say they are safe. So that is for those who are asymptomatic, who come from countries which are affected. For the present moment, that is Guinea, Sierra Leone, and Liberia. Although Senegal and Nigeria had cases before, but they have control and they have passed the 42 days of no cases. WHO has declared that there are no more countries of source of infection. So for those who are asymptomatic but with contact, we'll monitor them for 21 days. But those who had contact and are symptomatic, then we will manage them. That means they will be sent to the nearest health facility. And throughout the country, we have isolated 21 hospitals, which will be the initial place for referral, including Sabah and Sarawak and Peninsular Malaysia, for testing and observation. And subsequently, those who are positive, they will be managed in 3 hospitals. One is in Sungai Buloh, one in Kota Kinabalu, Hospital Elizabeth, Queen Elizabeth, and Hospital Umum Kuching in Sarawak.
Seri akan hak Malaysia. Orang-orang tadi negara ini datang Malaysia.
Student ke apa?
So far, every day, in the so-called quarantine thing, we see about 100 people who come mainly from Nigeria. But now Nigeria is cleared by WHO, so it's quite safe. From the other 3 countries, Sierra Leone, Liberia, and Guinea, that's not so much. The number who are coming here is very, very low because they're also doing what we call exit screening at their country. If they got fever, they got issues, they're not allowed to go. So that is helping us control it a bit.
How many workers or how many Malaysians are still living in the 3 countries?
In the hundreds lah, not many.
Datuk, berapa ramai staff yang di-train macam tadi?
Oh, Christopher. How many staff have we trained so far?
In Sungai Buloh.
Sungai Buloh and the other hospitals, they also do the same training?
Yes, a lot of things. So I don't know the details of each of the hospitals, but in Sungai Buloh, we have 8 MOs who are trained just to do this.
MOs, nurses?
Nurses 60.
60.
16
nurses.
Very specific team.
Okay.